Yes, sir. A 26-year-old woman presents with a painless genital ulcer and regional lymphadenopathy. Serology confirms primary syphilis. She has no drug allergies. What is the most appropriate treatment? Option A, doxycycline 100 mg BD for 14 days. B, ceftriaxone 500 mg IM daily for 10 days. Benzathine penicillin G 2.4 million units IM single dose. D, azithromycin 2 gram orally start. E, amoxicillin with probenecid for 14 days. It is C, benzathine penicillin 2.4 million units IM single dose.
Yes, go ahead.
Second question, 30-year-old pregnant woman at 24 weeks is diagnosed with early syphilis. What is the recommended treatment? A, doxycycline 100 mg BD for 14 days. B, benzathine penicillin 2.4 million units IM single dose. C, azithromycin 2 gram start. D, ceftriaxone 500 mg IM daily for 10 days. E, amoxicillin 2 gram TDS for 28 days. Answer is B.
Yeah, I mean to say. Okay, and pregnancy
The
you don't
benz
use
First
doxycycline.
2 trimester it is
no,
single
sir,
dose.
in
Third
B,
trimester it is 2 doses.
benzathine penicillin, you give only single dose at 24 weeks.
Yes, yes.
That's what.
Third trimester, 28
Okay.
week onwards, doctor.
Okay, sir. Okay.
Okay. See, let's syphilis. Okay. Sorry, not this. Yeah, this is the early up to 28 days. Okay, single
First
dose.
2
Okay.
trimester.
Okay. Third
Question number
question.
3. A woman at 32 weeks gestation is newly diagnosed with early syphilis. What is the recommended treatment? A, benzathine penicillin 2.4 million units IM single dose. B, benzathine penicillin 2.4 million units IM on day 1 and 8. C, doxycycline 100 mg BD for 14 days. D, ceftriaxone 500 mg IM daily for 10 days. E, azithromycin 2 grams start. Option B, benzathine penicillin IM is given weekly 2 doses on day 1 and 8.
Yes, yes, correct. Okay. Next.
40-year-old woman is diagnosed with latent syphilis. What is the first line treatment? Benzathine penicillin 2.4 million units IM single dose. Benzathine penicillin G 2.4 million units IM weekly for 3 weeks. Doxycycline 100 mg BD for 14 days. Ceftriaxone 500 mg IM daily for 10 days. And E, azithromycin 2 gram start. For
Latent.
40-year-old. It is
In the late,
option
it should
B.
be B.
Correct,
B
correct.
option.
Don't get confused. Okay. Benzathine penicillin is the drug of choice unless you have been given that there is an allergy or something like that. Okay.
Yes, sir.
Whether she's pregnant, non-pregnant. Okay. Next.
Question number 5. A patient treated for syphilis develops fever, headache, myalgia, and worsening rash within 12 hours of therapy. What is the most likely diagnosis? A, penicillin allergy. B, septic shock. C, Jerish eczema reaction. D, drug-induced lupus. E, Stevens-Johnson syndrome. So, C, Jerish eczema reaction.
Yes, it is developing within 24 hours. Okay. And the presentation is same. So for early syphilis in third trimester, 2 doses of benzathine penicillin. Okay. Late latent cardiovascular grammatis syphilis weekly for 3 doses. Okay. Jarisch-Hertzheimer reaction, acute febrile. Okay. So this was the answer for this question, 2 doses, question number 3. Okay. Clear?
Yes, sir.
Next.
Which
Yes.
of the following is most characteristic feature of secondary syphilis? A, painless genital ulcer. B, palmar and plantar rashes. C, gummatous lesions. D, aortic aneurysm. E, tabes dorsalis. It is B, palmar and plantar rashes.
Yes, go ahead.
A pregnant woman with untreated syphilis undergoes ultrasound. Which finding most strongly suggests fetal infection? A, oligohydramnios. B, polyhydramnios. C, non-immune hydrops. D, placenta previa. E, breech presentation. It is C, non-immune hydrops.
Correct. Okay.
Yes.
So secondary syphilis commonly causes maculopapular rash involving palms and sores along with systemic symptoms. And here non-immune hydrocephalus is a classic sign of fetal syphilitic infection. Next, doctor.
A patient suspected of having syphilis has a negative VDRL test despite strong clinical suspicion. The test becomes positive after dilution of serum. What phenomena explains this? A. Hook effect, B. Poisson phenomena, C. Cross reactivity, D. Antigenic variation, E. Complement fixation. Let us B. Poisson phenomena.
Why it is a what is the reason for Poisson phenomena?
Because after dilution of serum, the test becomes positive.
Yeah. In undiluted sample, the antigen antibody complex
That
does
is
not
it.
get formed. Okay. Next.
A newborn presents with hepatosplenomegaly, rash, and nasal discharge. What is the most likely diagnosis? A. Neonatal lupus, B. Congenital syphilis, C. Congenital toxoplasmosis, D. Cytomegalovirus infection, E. Neonatal herpes. It is B. Congenital syphilis.
Yes.
Patient with cardiovascular syphilis is started on treatment. What additional medication should be given? A. Aspirin, B. Prednisolone, C. Methotrexate, D. Azathioprine, E. Ibuprofen. It is B. Prednisolone, which should be started 24 hours before antibiotics should be given for 3 days.
Yes. So question number 8, the Poisson phenomena is there. Okay, and question number 9, classic feature of congenital syphilis will be snuffles, hepatosplenomegaly, rash, and bone lesions, and prednisolone 40 to 60 milligram daily for 3 days, starting 24 hours. Bina, madam, you want to go ahead with EMQs?
Let me see the questions first.
Questions, yeah.
First line treatment for early syphilis in adult is, let me see the option. It is A. Benzathine penicillin 2.4 milliunit intramuscular single dose.
Yeah. Next.
Treatment for early syphilis if penicillin cannot be used. Options are, it is ceftriaxone D 500 milligram intramuscular for 10 days.
Yeah. Next.
Alternative parenteral treatment when penicillin is contraindicated but no anaphylaxis. Parenteral. What other parenteral, doctor?
Amoxicillin and probenecid for 14
But
days.
that is oral, I suppose, when the patient has injection phobia and all that.
Yes, that is
Then
injection
amoxicillin
phobia.
oral and probenecid 500 milligram QID for 14 days.
So patient, there is no anaphylaxis, but the parental treatment, alternative
Ceftriax-
parental treatment they are asking. That means the other route is okay.
Ceftriaxone.
Okay. So option A, C, and D are the answer. What is D? Ceftriaxone 500 milligram IM daily for 10 days. So
Yes.
ceftriaxone 500 milligram IM daily is given if there is actually allergy to the penicillin, but not to the cephalosporin. Okay, then you use
Yes.
ceftriaxone. Here, the
Yes.
other option can be amoxicillin plus probenecid because there is no anaphylaxis. Okay. So, but the answer which is given is D here. Other are correct, A and C. Okay.
So
No,
here the
C is
answer other
C.
parental should be D.
Doxycycline.
Ceftriaxone
Doxy is
500
why your treatment for early syphilis if penicillin cannot be used. If penicillin here it is in non-pregnant state, so doxy can also be an option here.
So
Okay,
the option was not there, no? That it is pregnant or non-pregnant. That's
which one?
Doxy can be used if she is not pregnant. So let me see the question.
This is not for pregnancy related, no.
Yeah, this is just early syphilis, not
Early
pregnant.
syphilis, yeah. Okay,
Then it is doxy.
yeah. Treatment in pregnancy now. Okay, these are so early syphilis.
At 16 weeks, it is single dose A benzathine penicillin.
Second,
Early syphilis at 34 weeks. Then it is 2 doses. Where it is written 1 and 8 B.
doctor.
3 doses, third trimester.
Early
Three
syphilis,
weekly.
no,
Early
correct.
syphilis, huh, 2
Day
Three
one,
doses.
weekly.
yeah.
Yes,
Okay,
C
so
is the answer.
it
Yes.
is early syphilis we are treating. Okay, late syphilis.
One dose
doses.
at every week, so 3 dosage.
Okay,
Late
C.
Weekly 3
latent
doses.
Correct?
is answer. Yes.
Okay.
Then
So,
6.
ABC.
actually questions are simple, but we get confused. Okay. Next.
Most character feature of primary syphilis is chancre. A.
Yeah.
Classical feature of secondary syphilis is condyloma lata.
Yes.
And late syphilitic lesion, this is gummatous.
Absolutely.
Any other?
Any
Any
other, it
other?
can be
No, I'm just
cardiovascular, aortitis.
actually late syphilitic lesion. There are many, but
Secondary
earliest will be
syphilis
this.
में condyloma lata and the palmaris.
Let us see what is the A, B, and D. A is chancre, B is palmar
Palmaris,
rash, D is
condyloma
gamma.
lata.
Okay.
And
Next.
nasal discharge in congenital syphilis is A. snuffles.
Yes. Go ahead with
Bone
the next.
inflammation in congenital infection. Osteochondritis. D.
Yes.
Severe fetal complication detected on ultrasound. Hepatosplenomegaly. Hydrops vitalis. D.
ED.
D. Hydrops vitalis.
Hydrops
ABD.
vitalis. Okay. B is osteochondritis second, and first is A. Okay. Dr.
False
Sinchana,
negative test due to excess antibody is
false
prozone.
negative. What is?
So,
False negative test due to excess antibody is prozone phenomenon. G.
Correct.
Preferred screening test detecting IgG, IgM. Yeah. So this is D or C. Please clear the confusion.
TPPA is
TPPA
preferred
and
over
TPHA both?
TPHA. Okay.
Both TPPA and TPHA?
TPPA is preferred over the TPHA.
We prefer TPPA over TPHA. So IgM, IgG or TPPA.
Yeah.
This is the
Next.
answer.
Yeah.
Confirmatory test when screening is positive. Confirmatory test when screening is positive. RR.
I think it should be
preferred screening
again
test can be EIA,
no, again I think it should be
TPPA.
TPPA or immunoblot. If this fails standard confirmatory test, then you go for immunoblot. Let us see what
Yes.
they have given.
GEC.
G, E, and C.
C they have written.
EIA.
This is G. So G, E. E is trypanosome, EIA.
EIA confirmatory test.
C is
TPPA.
TPP. Confirmatory test is TPP. Okay. Preferred screening test. Yeah. EIA detects both IgG and EIA or CLIA. Both detects IgG and IgM. Actually, you have to prefer the test which detects both IgG and IgM. So EIA or CLIA is correct answer. EIA is
14
also.
May, I think, sir, it is trypanosome EIA. We do IgG and IgM of EIA.
Yeah.
So E is the answer for 14 question.
Yeah, 14 question.
And confirmatory test when screen
TPP.
positive is TPPA.
TPP. Yeah, because that is a standard confirmatory test, and if the standard confirmatory tests are not finding, then you go for immunoblot. That is what is given in the guideline. Okay.
We always start screening with EIA or CLIA.
Then comes TPPA or TPHA as a secondary confirmatory test. Okay. And if both are positive, then the patient is positive, and then you do VDRL and RPR. Okay.
Yes, sir.
Yeah. Next.
Acute febrile reaction after treatment is a Jarisch-Herxheimer reaction,
Yeah,
seen in 45% of cases.
correct.
Mechanism of this reaction is when the release of cytokines, that is K,
Okay, correct.
and reaction prevented partially with steroids in severe cases. 18. What is the answer?
Reaction prevented partially with steroids in severe
Steven
disease.
Johnson syndrome.
No, which
Steven
reaction is
Johnson.
prevented with steroids?
Reaction prevented.
Same, no,
Sir, आप
Jarisch-Herxheimer
बता
reaction.
दीजिए. You tell us.
Same Jarisch-Herxheimer reaction, no? Same reaction.
Anaphylaxis.
We are giving the steroids for same, no? For prevention of this reaction.
Jarisch-Herxheimer reaction.
Reaction which is prevented partially with steroids in severe disease. This is the reaction which we want to prevent. Okay.
Because Steven Johnson is not seen in syphilis, it is with this sulfonamides.
Yeah. Okay, the Jarisch-Herxheimer reaction occurs due to the cytokine release following rapid destruction of spirochetes. Dr. Sinchana, try this.
Syphilis in pregnancy. 27-year-old woman at 14 weeks gestation is diagnosed with primary syphilis. She has no known drug allergies. Benzathine penicillin 2.4 million units single dose will be given for her. A 32-year-old woman G2P1 is found to have positive TPHA and a low VDRL titer at booking. She reports treatment with penicillin 5 years ago. No further treatment is required for her.
She is positive for TPHA and low VDRL titer at booking. So these tests can be positive even if she is adequately treated. Okay? So no further treatment is required. Okay. So benzathine penicillin single dose. Okay. No further treatment required because a low trypanosome titer with positive trypanosome test may represent past treated syphilis. If treatment history is reliable and there are no signs of reinfection, no further treatment is needed, but continued monitoring may be advised. Yes, go ahead with the next, Dr. Sinchana.
25-year-old woman at 24 weeks presents with new diagnosis of early latent syphilis and has a history of anaphylaxis to penicillin. Options.
Options.
Desensitization and penicillin therapy.
Next.
A term baby is born to a mother who was diagnosed with syphilis during pregnancy but did not receive adequate treatment.
So baby is born to mother who was diagnosed with syphilis but not adequately treated.
Neonatal evaluation and treatment.
Correct. And what will be the drug of choice for neonate?
Penicillin.
Which penicillin?
Benzyl penicillin.
Yes, benzyl penicillin.
Benzyl penicillin because this is fast
60 to
acting
90. 60 to what was the dose? We'll
60
just go
to
by
90 mg per kg.
Per kg. That was a loading dose followed by there was something else also. Okay. Let us go back and see. See, 60 to 90 benzyl penicillin, 60 to 90 milligram
per
daily
kg
divided doses. Okay. 12 hourly in the first 7 days and then 8 hourly thereafter. Total duration is for 10 days. For first 7 days BD and last 3 days you give TDS. Okay. And alternative is a procaine penicillin. You got it?
Yes.
So that finishes the SBA and EMQ on syphilis. Thank you.
Thank
I
you,
hope
sir.
this session was
Thank you,
useful.
doctor.